So what we're going to start with for the eye exam is we're going to start with palpations. So I'm going to start at the bottom at the mandible. I'm going to feel up the mandible to the zygomatic bones. And then from there I'm going to go to the maxilla. From maxilla I'm going to go into the nasal bone and nasal cartilage. Feel if any false movement and pain. Then we're going to go to the frontal lobe. And then from the frontal lobe, I'm going to have her close her eyes a little bit, and I'm going to feel around for her orbital margins and feel at her orbit. Just feel it all up in there for anything. So what we're looking for with palpations is we're looking for any false movement, any odd ridges or anything like that, and for any pain that she might be having as I palpate along her facial bones. So for general inspection of the eye, what you're going to be looking for is you're going to be basically just like looking at them. You're going to see if there's any obvious deformities, whether there's like a drooping pupil or anything like that. You're going to look for lacerations or any blood or bleeding anywhere. Want to check for swelling or discoloration. You can also use your ophthalmoscope, and so you can find your number. The way you can find your number, if you're just looking at like the gross part of the eye, not trying to look super detailed, is you pick it up to your eye, and you want to look at something kind of far away, and you move it until you can see the object you're looking at clear enough, and then you can go and you can look more in depth at the eye, making sure that everything looks fine. You want to make sure pupils are equal, and that bilaterally both eyes are looking very similar. So the next thing we're going to do is I'm going to check her pupil responses, so we're going to make sure that they're equal and reactive. So what I'm going to have her do is I'm going to have her look at the light switch that is right behind me, that is equal level to me. I'm going to have her cover up one of her eyes, doesn't matter which eye you want to cover it with her hand. I'm going to turn on the light on my ophthalmoscope, and I'm just going to shine it into her eye, not directly, but I'm going to shine it into her eye to watch them constrict. Awesome. Okay, now can you do the other one? Awesome. So both of them constricted equally, and they're both very reactive, so she passed that test. Okay, so now we're going to do eye tracking. So what I'm going to have her do is I'm going to have her look at my finger, at the very tip of my finger, and she's going to track it without moving her head to check for the muscles in her eyes. So we're going to go side to side, up and down, and then we're going to go corner to corner, corner to corner, and she did a great job. So for this portion of the video, we're going to be doing the Snellen eye chart. So here we have the Snellen eye chart up on my computer, and we're going to have Zoe, who's 20 feet away. She's going to cover one of her eyes. You can do right or left. And so what I'm going to do is I'm going to have her read line 1 first. So can you read line 1 for me?
E.
Okay, then we're going to be going left to right. Okay, line 2.
F.
And then
P. T. O. Z. L. P. E. D. P. E. C. F. B.
okay, can you read this one for me?
L. P. E. D.
Okay, now this one.
P. E. C. F. D.
So she is at, so the way you can read the chart is you tell them which line you're going to do, or you can point at it and tell them which way you want them to read it. You have them go all the way down. The numbers on the right tell you if they can see this, what people can normally see at 20 feet, at whatever feet it's at. So 20/20, people can see this at 20 feet, and normal people can see at 20 feet. So that means they have 20/20 vision. The lower you go, the better the vision is. So this would be 20/15, and so on. The higher the vision is, then normal people can see it at 20 feet, while this person can see it only at 30 feet. So what you do is you have them read the lines. If they miss a letter on the lines, you have them go back up, try to read that one again. If they can, try the next line again. And if they cannot get it, then they're the line above it. So for this portion, we're going to be doing a retinal exam. So what I'm going to do is I'm going to take my ophthalmoscope, and I'm going to look at the palm of my hand, and I'm going to be changing the number until I can clearly see the lines on my hand. Okay, so once you can see that, then what you're going to do is if you're looking in the left eye, you're going to be using your left, or which eye is it? This is my left, so we're going to do it right. So if you're looking into the right eye, you're going to be using your right hand